Hello everyone and welcome to today's webinar with HIPAA Journal, the roles and responsibilities of a HIPAA security or privacy officer. My name is John Christopher and I'm going to be your host today. And now I'd like to introduce today's presenter, Howard Jones. Mr. Jones has been an independent consultant to physicians and hospitals since 1980 and also has provided services related to practice management and regulatory compliance issues, section of billing and AMR systems, and the designs of EMR templates for practices and EMR vendors. Jones has focused on providing services related to healthcare regulations since 1992. Before I hand the session over to Jones, I would like to tell you that the session is for 60 minutes and you will have a Q&A at the end of the session for 10 minutes to keep the session more interactive. If you have any questions in between, you can use the chat window to ask your questions and Jones will answer them at the end of the session. We will mute the attendees line to make sure that there is no background noise interference in between the session, so it makes the presenter's voice clear for everyone to understand. I think Jones can take it over from here.
Okay, well, we have much to cover today, so we just need to get started. I basically have one major objective, and that's to give you an understanding of and a detailed job description for this position that's mandated by HIPAA regulations, and that's a HIPAA Security Privacy Officer. Okay. One of the things that I want to tell you is that I'm going to address this thing under the assumption that you actually have this position, because people who log into this either have the position, they're seeking the position, or they're in charge of filling the position. So it's easier for me if I just assume that you've got this position. So let's get going. You and I know much has been written about HIPAA. Okay, it is this 20-year-old plus thing has expanded in its content and in its application over the years. Okay, the regulations are numerous, they're complicated, they're often vague by accident, sometimes they're vague by intent, personal opinion. But regardless, okay, HIPAA affects every person that works in a healthcare facility. And webinars like this, the regulations are usually addressed from the perspective of maybe a new regulation that's come out and what it entails, the necessity of compliance with that regulation, and the consequences of willful neglect or non-compliance. But I'm going to take a different perspective. Mine is going to be from a personal perspective. And that's from the perspective of the person who's in charge of moving an organization or facility toward full compliance with HIPAA. So let me begin by just throwing out a question. Okay, in your organization, who's in charge of taking your organization out of willful neglect and moving it toward full compliance with HIPAA? Or maybe the question is there anyone in charge? I don't know, okay? But I just throw that out at you. There are, in my study of this over the years, what I've seen is that this position really has three goals, okay? The first goal is to implement and oversee all HIPAA security privacy requirements throughout the organization. Obviously, you got to do this in accordance with laws and with rules and regulations, but it's going to include tracking the status of compliance with these rules and regulations. The second goal is to oversee all ongoing activities related to HIPAA security and privacy policies and procedures, obviously still in accordance with rules and regulations and laws, but includes development, implementation, training, and maintenance. And the third goal is you're going to have to work with management and staff members in the development, implementation, communication, assessment, revision, and daily management of your organization's corporate compliance plan as it relates to HIPAA regulations. Okay, and so we're going to cover all of this. So let me begin by saying that goals 1 and 2 overlap, and so we're going to address this thing. Goal number 1 is to implement and oversee all HIPAA security and privacy requirements. And number 2 is after you implement initially, then you have to have ongoing activities related to it. So now as I'm talking to you, I'm going to basically include those two together rather than to try to separate them. It just makes it clear to you. So what do you need to know about compliance with HIPAA? Okay, you need to know what to do and why you should do it. But more importantly, you need to know how to do it. And very often that's a problem for you if you're listening to someone telling you about these regulations, new regulations that come out. They don't always give you a clue about how to do it. Okay, I'm going to tell you how to do things today. So let's take the beginning of this thing, looking at the position responsibilities for goals 1 and 2. The first one is you've got to become knowledgeable in and stay abreast of regulations. That's the starting point. Okay. That means you have to maintain a working knowledge of legislative and regulatory initiatives that are directly or even indirectly related to HIPAA security and privacy. So to do that, you're going to have to seek and track sources of information that are going to provide you with the most accurate information you can that's either directly or indirectly related to HIPAA security and privacy. So what are these sources? Well, you need to focus on these for sure. Okay, HHS, Health and Human Services, CMS, that's Medicare, the OCR, Office of Civil Rights, these are the folks who audit you. The ONC is sometimes helpful. The Office of the National Coordinator, they certify EHR systems. And the real key one now is the NIST, and that's the National Institute of Standards and Technologies, because they basically set how you do things. So these are key sources. You need to find the right resources that you can read there, and recognize that things will overlap. Okay, as I talked earlier about complications. So all that you need to know is not in one place. That's what makes it tough. Okay, multiple government agencies are involved in it. Each has their own publications that refer to regulations and other agency publications, which is why there's so much confusion sometimes. It's a very commonplace thing. Seeking and tracking is difficult. I'd be lying to you. I'd be remiss in my responsibility if I didn't say that. It is tough. It is difficult. Okay, but still, it's part of the job. So let's get started. Okay, as far as seeking and tracking information sources. Okay, you need to be able to interpret and translate requirements of implementation within your organization. Now you got to remember, regulations are vague, and some people really cannot interpret something complex and make it simple. So the summary here is that you're going to be reading complex stuff. The Federal Register, for instance. The key to reading the Federal Register is to know what not to read. That there's only the last paragraph, so to speak, that really has the meat of what's going on. A lot of it is just talk that bureaucrats have to do. Okay. So that's sometimes what makes it, vague. Okay. What you've got to do if you want to be successful at this, you're going to have to take whatever information you get from the source, and you're going to have to translate it in fifth grade language. Okay. You have to make it simple. You have to make it easy for people to understand, or you're going to be really challenged to be successful. Now, some people can't do this. Okay. Some people just don't have the gift of interpreting something complex into something simple. And you may be one of those people. That doesn't mean that you can't have this position. It just means you need help. You're going to have somebody who can take this and to create another document that you can hand out to somebody else that they can understand. So keep that in mind, please. You're going to have to maintain a current and appropriate body of knowledge necessary to perform all of these information management functions related to security and privacy. Okay. You're going to have to you're going to be collecting this huge body of knowledge. You've got to be able to take care of it. Okay. What's going to happen? You're going to be able to track announcements of things to come. You're going to have to keep up with regulatory changes and their effective date. Okay. You're going to have to have an effective way to reference what you need. I mean, you and I know that whenever a regulatory change comes out and they give a date to it, the odds are that that's not when it's going to happen. The odds are you're going to get a follow-up saying, okay, this has changed, it's been put out to this thing. You got to track that stuff. You're going to have to watch it so that you'll know what to do and how to do it. You need to closely follow the passage of new HIPAA regulations, okay? And the way to do that is just through ongoing online training programs. Just get a deeper understanding of these through training programs, okay? There's lots of people out there that are watching regulations. When they finish seeing it and reading it, they write blogs about it. Then they'll actually do online training programs like this. You're going to have to follow through with those things. That's a great source for finding out. You just need to find the people that you really like the most, that you can understand. You need to monitor advancements in information security and privacy technologies to ensure that you're up to date. Okay, that you can adapt and put these types of things in place when it's necessary to do that. Okay? You may not be a techie, but you're going to have to follow those or have somebody that's following that give you a translation of it. One way to do this is to request emails from industry leaders like HCCA and AHIMA. Okay, they have some good stuff there. I have found on LinkedIn there's a whole set of blogs that are people called innovators, and I have found some good information there over time. So these are things that sources that you can think about. Now, once you've gotten started, you've got your sources. Okay, you know how to track them. You know what to do there. You got to get started. Okay, and that means you got to initiate compliance with HIPAA regulations. And there's a clear definition of what the starting point is, and it's in the Federal Register, 45 CFR 164.308. That's where you find out what an initial security risk analysis is and how it needs to be performed. That's where you find it. Okay. So what is its definition? It's very simple. It has 3 points to it. You have to conduct and review a security risk analysis in accordance with the requirements in the Federal Register. And you're going to have to implement security updates as necessary later on, and you're going to have to correct identified security deficiencies as part of the risk management process. That's what it says. Okay? That's the foundation of what your job is. Now let's break that down into details. Okay? Let me give you the 50,000-foot view of this thing so that you'll understand. Basically, what you're going to do is you're going to assess the security status of all your in-house technology. You're going to take an inventory of all your UTM tools. UTM means Unified Threat Management, firewalls, antivirus, anti-spam, that kind of stuff. And you're going to have to assess the security status of your facility based upon policies and procedures. Okay? So there's 3 things there. You're going to have to look at technology. You're going to have to look at software. You're going to have to look at policies and procedures. Now, let's take it down to a 10-foot level, okay? Because the OCR requires that you address 9 specific elements, okay? So let's look at what those are. The first one is you have to come up with the scope of the analysis, okay? We'll talk about that. You're going to have to do data collection. You're going to have to identify and document potential threats and vulnerabilities. You're then going to have to assess current security measures. Then you'll have to determine the likelihood of threat occurrences, potential impact of a threat occurrence, determine the level of risk of that threat occurrence, document the findings with content that will pass the scrutiny of an auditor. Okay, we're going to talk more about that. That's very important. And you're going to have to do periodic review and updates to the risk assessment. Okay. That's how you have to think about it. That's how the OCR is going to judge you. So let's take the first element. Okay, you got to determine the scope of the analysis. So what does that mean? Okay, because HIPAA is all about protecting protected health information. First thing you have to do is determine and document where is protected health information generated, where does it reside, where is it stored, how does it flow through and out of the organization, and where is all this stuff backed up? Off-premise, if it is. You need to find all that. Why? Because that determines the number of sites and business associates, which we'll talk about separately, okay, that require a risk assessment and their status. So you're determining the scope. The purpose of the scope is to determine how many sites you got to deal with. Then the next step is to identify potential risk and vulnerabilities to the confidentiality, availability, and integrity of all electronic protected health information that you create, receive, maintain, or transmit. Now, this is going to lead to the next element required by the OCR, okay? And that is you got to collect data necessary to do the analysis that's going to meet regulatory requirements, okay? And this includes 5 categories defined by the OCR. Once again, I'm letting you know what the OCR is going to be looking for. The first thing is physical safeguards, and that's the physical places where electronic protected health information or just paper protected health information is accessed. Okay, what kind of computers have you got? What safeguards do you have there? Are you using tablets and phones to search information? How secure are those things? So it's physical safeguards. It comes under that category. And there are administrative safeguards. You have to have a designated HIPAA security privacy officer. Now let me pause for a second to help you with this. If an auditor walks into your door today the first thing they're going to want to do is find out who is the HIPAA Security Privacy Officer. They want to meet with them. They're assuming that that's right. If they discover that you are the HIPAA Security Privacy Officer, but you also have another title, okay, you could be in trouble. Let me give you the worst example that I've ever dealt with, okay, and that is a large hospital facility. The HIPAA Security Privacy Officer was also the Chief Financial Officer. Now, you and I know that the Chief Financial Officer of a large facility has a full-time job. And to say that that person also is heading up HIPAA security and privacy, it won't work. You'll immediately be in trouble as far as the audit is concerned, because they'll know you can't cover all that stuff. So they'll automatically question everything else that you do. Not a good thing, okay? Other administrative safeguards are workforce training and oversight, controlling information access, periodic security assessments. They're going to be looking for those kinds of things. We're going to talk about those. They're going to be looking at technical safeguards, security settings on your computers, UTM tools, Unified Threat Management, software. And then software tools, there's software tools out there now that will identify actually abnormal events that might signal an active threat to the security of your protected health information. You might want to, if you're not into those, you might want to look into those, okay? Those are technical safeguards. There's more of them, okay? There's controls on access to electronic health records. There's the use of audit logs and syslogs. You need to protect electronic protected health information from improper changes and secure authorized electronic exchanges of protected health information. Those are technical safeguards that you could be addressed. First, the next category is policies and procedures. There must be written policies and procedures in place, okay? You may not have any at this point at all, because you're just getting started in this thing, okay? And that's not a problem, and I'll explain it to you later on, okay? But then you're going to have documentation of security measures. So your documentation is going to be an important part of this thing. And then you're going to have business associate agreements with anybody that you share your information with. Those are the categories that you need to keep in mind. Now, let's just revisit the other elements that are required by the OCR. Okay, we've talked about the scope. We've talked about data collection. The other one is to identify and document potential threats and vulnerabilities, to assess current security measures, to determine the likelihood of a threat occurrence, to determine the potential impact of a threat occurrence, to determine the level of risk, I suggest by NIST standards. We will be talking about them, and document the findings with content that will pass the scrutiny of an auditor. Okay, so can you do all of this? That's the question. If you have this title as a HIPAA Security Privacy Officer, can you perform an initial security risk analysis? Can you produce an initial security risk analysis that will report that report will actually pass the scrutiny of an audit? Or do you need help? Okay. The fact that you can't do that doesn't mean that you can't have this job and this position. It just means you need help. And you need to recognize that if you absolutely know, I can't do this, then what you've got to have is somebody that can help you with that. So let's go back to the definition of the initial security risk analysis. Okay, you got to conduct the risk analysis in accordance with the Federal Register requirements, and you have to implement security updates as necessary, and you got to correct identified deficiencies as part of the risk management process. So what does that mean? It means you have to develop a plan of action. Once you've gotten started, okay, you've initiated compliance, you have to have a plan of action. What are you going to do after that? Okay, in accordance with addressing the risk and deficiencies that you found in that initial security risk analysis report that you came up with. So, in developing this plan of action, understand this: the Federal Register tells you what to do, but the NIST standards, which are endorsed by the people who audit you, okay, they're the best source of knowing how to do it. All the how-tos I'm going to talk about today are based on NIST standards. So let's talk about this plan of action. First thing you have to do is develop the first deficiencies that were addressed. Okay, you've already done the initial security risk analysis. Okay, You've already collected information on that. You've already seen where deficiencies are. Okay, and you have an initial security risk analysis report that you've developed. Okay, and you printed. Now what you have to do is decide what to do next. Okay, identify the first deficiencies that you want to address, and you can do whatever you want to do. Okay, whatever you found. Okay, but you have to take steps necessary to remediate these deficiencies, and that involves three things. Number one, either developing and executing policies and procedures, implementing and installing technology, or implementing and installing physical safeguards. That's it. There's only three things that are involved with remediation, either policies and procedures, technology, or physical safeguards like locks on doors, that type of thing. So let's start moving on through this thing. You need to ensure that all employees affected by the changes implemented are appropriately trained in their meaning and application. Now let me pause for a second here and help you understand why I've underscored meaning and application. Trust me on this now. It's not enough for you to sit down with somebody and tell them that there's some changes that are going to be coming down the pike and their job is going to change in some way. Maybe there's a new application that they're going to have to look at. Whatever it is, you just sit there and explain to them. And if all you do is just tell them what they're going to have to do, and you don't tell them why, the odds are you're not going to have success. You need to, in addition to saying, okay, you got to do this, now let me tell you why. Because if we don't do this, if you don't change your role a little bit and add this to it or replace with this thing, then what's going to happen is we're putting ourselves in harm's way. And if we end up with an audit and if we end up with a heavy fine, that could cost all of us our jobs. Okay, so you need to let people know why. What's the meaning of the things that you're asking them to do? You need to update the initial security risk analysis once you've taken any steps at all. Actions taken, pending actions, or pending meetings. Now, I'm going to talk about pending actions, pending meetings in a minute. But you've already had the initial security risk analysis. You have taken some steps, okay? And now what we want to know, or what you need to do is update the security risk analysis with everything that you've done. You've got to update this report so that you can track what you've accomplished and you then know the deficiencies yet to be addressed. This is all part of the plan that we talked about earlier. Okay. Now let's bring something else into this thing at this point in time. Okay. Everything I've mentioned up to this point is referring to you, a covered entity. Okay. But what about your business associates? And who are your business associates? They're outside labs. They're people that you're passing tests on to. You're sharing confidential information with them. Okay, those types of people. You've got to identify all your business associates, all of them. You see, all is all caps. It's all of them. And that's an organization that either creates, receives, maintains, or transmits protected health information that came from you. Okay? Okay? Or that they passed on to another business associate. Okay? So the odds are that they didn't necessarily create anything, but they received it, they may have transmitted it, they may have maintained it and updated it. Okay? Those are the definitions, the official definitions. So keep those 4 words in mind. Who are business associates? Well, insurance carriers. You don't have to worry about that. Every insurance carrier from day one, they were ready to sign BA agreements. Why? You can't do billing unless you pass on protected health information, right? Attorneys. If you have attorneys that work for you, most facilities do. If they are going to have access to protected health information because of the task that you hired them to do, they need two contracts. One, the legal contract to pay them, and the other one is a business associate agreement in which they commit that they will not share any of this information that they see with anybody else. And the same thing is true with consultants. If you were hire me to come in there and to do something for you, and I have access to medical records and protected health information, I would have to have 2 contracts as well. Okay. Cloud-based EHR vendors. I don't think this is a problem anymore. It could be isolated things, but I live in Memphis, Tennessee. There's about a half a dozen of these cloud-based electronic health record vendors that are out there. And I went to each one of them and told them about all this, and they just blew me off. Okay, they just said, hey, we've got our own closet, so to speak, in the sky where all of our technology is, and it's all safe and it's all secure, and we don't need to do any of this stuff. Well, they found out later on that that's wrong, okay, because any business that you deal with is going to have to do exactly what you do. Exactly. Any business with whom you share protected health information. And now they get it, okay. So the next thing you got to do is initiate compliance with HIPAA regulations, okay? And that means you got to communicate with every business associates and determine their status regarding compliance with HIPAA, okay? So the best way to find out if they are doing anything about it is just ask a simple question. Give me a copy of your initial security risk analysis report. Now, if they don't have one, and they don't have a clue what you're talking about, just assume they're in willful neglect. And they're a danger to you when they're in that state, okay? You're going to have to develop BA agreements that will ensure that all privacy concerns, requirements, and responsibilities are addressed not only by your direct business associates, but any business associates that's down the line as well. An example would be you've got a lab that you outsource stuff to, and maybe there's one or two tests that they don't do, and there's a specialty lab, and they outsource it to that. So now you've got a BA that has a BA. That's what I'm talking about. So having said all that, okay, it's not enough for you to do what's necessary to protect the protected health information you generate. Any business or organization that's given access to your information, your protected health information, they got to do exactly what you're required to do. Do not let them tell you otherwise, okay? Under HIPAA regulations, okay, when a covered entity or BA agreements or BA delegates to a BA an obligation that involves PHA, you remain liable at the highest level. That's basically what you have to understand. You pass information on to somebody, they pass it on to somebody else. It doesn't matter if you got agreements with them. If there's a liability, if there's something that's breached down below, you're going to be responsible for it. So if BAs cannot prove to you that they performed an appropriate initial security risk analysis and that they have a plan for moving toward full compliance, and you will know what that is, you got to decide whether you want to continue to do business with them because there's a problem for them. So how critical is this to your compliance with HIPAA? Well, just think about it this way, just a quick allegory. Consider that what you do to your facility is protecting your front door. You can do a good job of that. But what you do with business associates is in essence protecting your back door. And if you don't deal with all of them, and any business associates they have, it will guarantee that you have an unlocked back door to your sensitive healthcare data. And that is a problem, okay? And without BA agreements, you will fail an audit. Trust me on that. Think about that. An auditor can have a very simple thing. All they have to walk in and say, I want to meet the HIPAA Security Privacy Officer, and I want to look at all your BA agreements. And if you don't have any BA agreements, you're in trouble, okay? Because you are outsourcing stuff to other people, I'm sure. So dealing with business associates, it's a tough job. No question. It's time consuming, and it never ends, okay? But if you don't take this seriously, it could cost you your job. If there's a breach down below there, you are in trouble, okay? So let's review once again the definition of the initial security risk analysis, okay? You start off by conducting initial security risk analysis according to regulations, and you implement security updates as necessary, and you correct identified deficiencies as part of the management process. So what does that mean? It means that you are once you get started, you are in a cycle of compliance. It never ends. It will never end, okay? So you need, and the regulations say this, you need to ensure that you're making progress toward full compliance with HIPAA at least every 90 days, every 3 months. That's what the regulations say. Now let me help you understand all that, okay? You need to ensure that initial progress, okay, is happening in your place. You need to ensure that an annual security risk analysis is performed at every facility. And there's a big difference between a security risk analysis according to HIPAA, according to Federal Register, and a security risk assessment that's conducted via a checklist. Let me explain that. Okay, I have an IT background. Okay, I have met a lot of companies, businesses that have relationships, and they do technical support for a lot of different companies, hospitals, clinics, and other types of people like that. And I've seen their checklists, and they're good. Okay, they're really good. The problem is they won't pass the scrutiny of an audit, and that's the pushback that they'll come to you. Okay, I got this great checklist. Well, yeah, but I have to put this report of yours into a format that will pass the scrutiny of an audit. Okay, please bear that in mind. So once you've gotten started, okay, and you've done one thing, you've done the initial security risk analysis. Okay, you've got the initial security risk analysis report. You've identified one thing that you want to work on. You've taken care of that, whether it's a policy and procedure or technology thing, and you've documented all of that. Okay, the next thing you have to do is identify the next set of deficiencies that you want to address. That's the cycle of compliance. Okay. So you need to take steps necessary to remediate whatever deficiencies you have, and there's only 3 things you have to address. You either update or create new policies and procedures, doesn't matter if they're IT or not IT related, or implement and install technology, or implement and install physical safeguards. You see, you're focusing on policy and procedures, technology, and locks, that type of thing. Those are the key things that you're going to be focusing on. You're going to have to ensure that all employees that are affected by any change that you put in place are trained in their meaning and application. Remember the meaning, okay? That's important. You've got to identify business associates all the time. You need to constantly find out, is anybody else, we have a contract with anybody else, any other department, okay, that they've signed a VA agreement. You need to know, or if they become a business, so you need to make sure that there's a VA agreement, okay? And you need to do that as rapidly as possible. And then you need to update the initial security risk analysis with all actions taken, pending actions, and pending meetings. Now, let me explain pending actions and pending meetings now. Earlier, I told you that the regulations say that you've got to make progress every 90 days. Okay, let's say you got started. You got in place, and now what you're going to be doing is deciding, okay, what's the next actions that I want to take. And suppose you decide this is what I want to do, and you want to do it in conjunction, let's say, with another department. You may find that you can't do it within 90 days because the other department has some big project, and they have to finish that before they can work with you on something. But if you record, okay, this is where documentation comes in place. If you're in healthcare, you know documentation is gold. Okay, if you just document, okay, that there is this pending action coming, or there's just a pending meeting, and that's all that's going to happen in the 90 days, that's okay. It's okay, okay? But it's got to be documented. You have to make that work. And you're going to have to track compliance with HIPAA regulations. This is the part that's really challenging, okay? Because it is absolutely the biggest challenge you have to full compliance. Full compliance, or actually any set of regulations, doesn't matter what industry you're in. Tracking is just a very difficult thing. Okay, so you're going to have to either develop or purchase a tool or system to track compliance with HIPAA regulations at every facility that you've got. So let me give you what the features that you should look for in this tool or this system. First thing is, you need to be able to collect a setting of samples of computers in your organization. This is part of the Federal Register of getting started on this thing. You basically need to find out what's the status of 3 computers. And I would suggest that what you do is you pick out the oldest computers that you've got. I get people say, why in the world would I do that? I'm going to get really bad scores. And the question, and my response is, yeah, but we don't care what the score is. What we care is for you to identify the worst computers that you have so that you know these are things I got to fix, I got to take care of. Now, the way to do that is with a piece of software called a SCAP scanner. Let me help you with that. There's about 12 or 13 companies in America that write a piece of software called a SCAP scanner. Okay. Now, what it does is it will actually identify the status of settings within your computer. So how do you get going on this thing? Well, you look up SCAP Scanner, you find a vendor that you want to do business with, you sign an agreement, and they will download you a piece of software called a SCAP Scanner. That's theirs. What you want to do is put it on a flash drive. And then you want to take this flash drive and go to computer number 1, stick it in the USB port, bring the SCAP Scanner software up and turn it loose, activate it, and you just sit back and drink a cup of coffee, because it's going to take a little while for them to just go in there and check the settings within your computer. Not a lot, not hours or anything like that, but it'll take a little while. And when it finishes, it's going to create a file. This software will create a file and implant it on the flash drive. So you have that for computer number 1, and then you go to computer number 2, computer number 3, and you do exactly the same thing. Now what you've got is that information. You've identified that that. Then you have to move on to you need to have a list of UTM tools that can store. Now let me back up and say, whenever you collected the information on the USB drive, you need a system that you can put that data that you have and embed it into that system, and it will actually calculate what the risk factor is, and that's OCR NCIS standards. Okay, it needs to have the capability to do that. So now all of a sudden you've got that in place. Then you need to get a list of UTM tools that are going to be stored in your system: firewalls, anti-spam, content filtering, that kind of stuff like that. Okay, when you record that list into the system, it will also calculate that the presence of these is going to basically lessen the risk factor. Okay, it will have the logic to do that. You need to take categories of HIPAA policies and procedures, and this system needs to be able to store those. And so and this is just a PDF file, a Word file is all it is. But when you put it into this system, it will calculate what the risk factor is now, based upon the fact that you have a policy and procedure in place. Okay, you don't have a clue how to do it. This is something that's embedded in the system. Okay, the risk factors and deficiencies based on NIST standards need to be calculated and identified, as I've been saying, and then tracked. This is a feature of the tool or system for tracking. And the features in this tool system it should generate a gap report. Okay, and what that means is showing the gap between the current status of risk factors or deficiencies and the status required by HIPAA regulations. So you're basically seeing where am I and where I need to go. Okay, that's why it's called a gap report. Now, this is a tool, okay, that you would use to determine what else you need to work on. And you got to have this if you're going to implement a cycle of compliance, which we've said you need to. Okay. So the status of risk factors and deficiencies, this system needs to be able to do this. It needs to update whenever remediation steps are taken or entered into the system. This system needs to be able to generate the initial security risk analysis, okay, in a way that will pass the scrutiny of an audit. Okay, it'll actually show you the current status of this. That's the first thing that you did, and it'll also generate security risk analysis that have been updated based upon input, things that you've shown. I've reached compliance here. I've made these steps. I've done whatever. Okay, and this once again has to pass the scrutiny of an auditor. This system should allow you to store and to track electronic documents, policy and procedures, BA agreements, any documents that's associated. And when you have those in there, that there will be calculations based that will determine risk factors as well. So the question is there anything out there like that? Yes, there is. Okay. Is there anything that can help you as a HIPAA security officer to track compliance? Yes, there is. Okay. When we finish this at the end of the thing at the Q&A time, if you're interested, I'll give you the name of a company that I've worked with. But there are tools out there that can do this. Okay, so you don't have to invent it. You don't have to write it from scratch. It's been addressed. Now let's move on to goal number 3, and that is the management of your department. Okay. Because you're going to have to work with management and staff members in the development, implementation, communication, assessment, revision, and daily management of your organization's corporate compliance plan as it relates to HIPAA. Why is that? Because you are the fountain of knowledge related to HIPAA. So that's going to be your role. So let's look at some details here about managing and overseeing the protection of protected health information. Okay, you're going to have to review all system-related information security plans throughout the organization's network to ensure that they're in alignment with what you know to be right as far as security and privacy is concerned. This means that you're going to be in bed with every department head. You're going to know them really well. You're going to have to initiate, facilitate, and promote activities that will foster an information and security and privacy awareness within your organization. In other words, you're going to have to be responsible for developing a culture of security and privacy, and there's all kinds of ways of doing that. It can just be regular emails, which will probably wear somebody out. You can have events, a security and privacy event where people have lunch and you talk about these kinds of things. You can have posters. This is not my wheel wagon, as you can tell right now, but it'll be something that will help you if you can develop that. You're going to have to oversee the initial security, privacy, and training orientation. We've already talked about this. Got to be training, right? Okay. Now, here's something to understand. You may not be a gifted orator. You may not be a gifted teacher. You may not be somebody who likes to stand in front of a crowd and to go through PowerPoint presentations and do all the things they have to do. Okay, that's okay. That doesn't mean you're going to lose your job. It just means you need help. Okay, what you need is somebody who can actually do that. But you need to be involved in the development of it because you are the fountain of knowledge. So you need to make sure that the content is correct and that what's being delivered isn't false, okay, even though you're not delivering it. The initial training is going to be given to everybody, okay, all your employees, all your volunteers, okay. The medical staff and professional staff, you're going to get a pushback from that, okay, because you're going to set up a training thing, okay, we're going to do trainings on these days at this times and everything, and people sign up for it. That won't work with the medical and professional staff. Why is that? These folks are busy, okay? They're doing important stuff. And you're going to have to work within them things and their nurses and their supervisors and the people that are helping them there. You're going to have to figure out a way to get them into the thing, and they're going to fight back on you, but you're going to have to press, okay? Because they have to understand all these things as well. Any contractors, okay, consultants, attorneys, whatever, okay, all BA associates, do not, I repeat, do not let any of these BA associates tell you that, okay, I'm going to develop my own training program and we'll do it in-house. That is not good enough. They need to go through your training because you are the fountain of knowledge, and you need for them to understand exactly what it is if you want them to do their job and be compliant, helping you be compliant, okay? And if they push back and they say they're not going to do it, then you need to decide whether you want to fire them or not. Because now they are a danger to you. Okay. Any other appropriate third parties, okay, they're going to have to go through the training. You're going to have to effectively apply information security management knowledge to enhance the security of the organization. Okay. You're going to have to apply that to everybody. Okay. You're the fountain of knowledge. People are going to be looking for that. You need to certify that IT systems meet predetermined security requirements. Now, you're going to get some pushback there because IT people are very smart, okay, and they understand security, okay. And I'm not saying that because I got an IT background. I'm just saying that's true, okay. What you need to do is approach them in a way that says, look, I've got this job. I'm in charge of security and privacy. Okay, you've got this thing. Let's compare notes. Let's find out how you're doing this stuff. So work with them. Okay, love them to the point that they will end up doing exactly what you want them to do. But don't start a fight with them. Okay, it won't help you at all. You need to then monitor the information security program compliance and effectiveness. Okay, in accordance with everybody else, with the organization's other compliance and operational functions. You got to monitor how things are going for you. You're going to have to potentially serve as a liaison in matters related to HIPAA security and privacy. Okay. You might the first thing you need to do is you need to form, if you're in this position you don't already have it, you need a security privacy committee. And this committee needs to be made up of other department heads and yourself, maybe even high-end staff people. Okay. Because here's what's going to happen: you're going to write all the policies and procedures. That's your job. Okay, to write all these, or have somebody write the content that you share with them about. And they're gonna write this thing. And if you write out a policy and procedure, and then you just announce to the whole organization, I just wrote this thing. Everybody's going to be required to be in compliance with this thing by next Thursday. You're going to have a lot of trouble on your hands. Okay, you're not going to do very well right there. You need to vet this before you ever take it online. You need to vet it before a committee that's made up of other people that will say, wait a minute, this rule is a little rough on me. I'm not sure I can adhere to it, and here's why. That all of a sudden the policy and procedure might be changed slightly with recognition of other challenges and whatever, but you can't do it alone. You need multiple brains to come into this thing and to approve this thing, so that your other department heads will support it. Okay. So this committee is going to help you prepare all the HIPAA-related policies and procedures before they're implemented. You need to serve as the information security and privacy liaison with users of clinical and administrative systems and all. Okay, there are going to be other departments, other systems that you're going to have to be connected to, and there's a whole variety of them. You don't even have time to talk about those. Okay, you need to act as a liaison to whoever is in charge of information systems in matters related to HIPAA security and privacy. Okay, whether it's your internal department or it's an outsourced department, you're the liaison related to the protection of health information. You're going to have to work with legal counsel and management to ensure that your organization has all the appropriate forms and notices, and there's a bunch of them, right? Okay, you got privacy and confidentiality consent authorization forms. You got information notices. You got materials that reflect current organization legal practices and requirements. You got a lot of stuff like that. So you need to make certain that the wording is appropriate from your perspective, from what you know. You need to work with all personnel that's involved in any aspect of the release of protected health information. You got to make sure that that's working right, okay, according to the organization's policies, procedures, and legal requirements. Okay, that's protected information. Anything related to protected health information, you're going to be involved in. You need to work with management, legal counsel, and parties to represent your organization. If anything is happening outside of your organization. An example, let's say you're a good-sized hospital, and there's a medical practice in your city that wants to go to the state legislature, and they want them to pass a rule that will help them. Okay, but it's a bad idea, and it's a bad thing for you. You may be the one to go with attorneys and whatever to be involved in that. That's a possibility that could happen. And obviously, you're going to have to work with HHS. The Office of Civil Rights for any audits that come in. You're the first person they're going to talk to. You're going to have to track access to protected health information. So you're going to have to establish with management and operations, not by yourself, okay, a mechanism to track access to protected health information within the purview of the organization as required by law. Okay, you need to allow qualified individuals to review or receive a report on such activities. Okay, these are all things that you'll know just through knowing the regulations. You need to oversee and ensure the right of organizations' patients to inspect, amend, and even restrict access to protected health information when that's appropriate. Okay, got to make sure that that's all flowing right. Otherwise, you're going to have a bunch of legal things on your head. You're going to have to investigate and resolve HIPAA complaints. This is a nightmare. I'd be lying to you if I didn't say this is a nightmare, because the HIPAA complaints could be nothing. They could be just somebody just dreaming up something, all the way to something that's really bad. Okay, but you're going to have to establish and administer a process for receiving, documenting, tracking, investigating, and taking action on all complaints concerning the organization's policies and procedures, regardless of whether it's stupid. Okay, it doesn't matter. Okay, you can't do. You're still going to have to track this. So you have to have a process for doing that. And you're going to have to, but you won't do that alone. Okay, you'll be collaborating with other people and probably legal action as well. And you're going to have to apply sanctions. Think about this. You're the one that wrote policies and procedures. They were approved by your committee. Okay, and if you're going to put a policy and procedure out there, there has to be a sanction for breaking that policy and procedure. And that could range all the way from a little slap on the hands to meaning you have to go through a little additional training now, all the way to losing your job. Okay, it could do that. Okay, you have to take this very seriously. Let's say you've got a friend, okay, that there's a sanction where they violated something, and the sanction is that basically they're going to lose their job. Okay, if you hide that, if you don't come forward with actually implementing that sanction, if this person doesn't lose their job with clarity as to why they lost the job, okay, you're dead in the water, because nobody is going to be held accountable again for any breach of anything you have. Sanctions could never be applied again. Why? Because one person got away with it. Okay, you cannot allow that to happen. That's why you need to be very careful about the sanctions. Okay, do not fire people and do something unless it is absolutely the worst possible thing that they could have done. So give that some thought. Okay, so you just have to ensure that there's a consistent application of that to everybody. Okay, including extended workforce and all BA associates. But you're going to have to, but you will do so not on your own. Okay. Once that comes up, you're going to go to management. You're going to go. They'll bring in legal counsel, and the decision will be made. It won't just be you, but it'll be your face that's doing it. And then you're going to have to manage all information security personnel. And in other words, you've got you won't be able to do this alone. So you're going to end up building a department. Okay, you have to do what everybody else does. That's a department manager. You're going to have to you decide who you need, what the personnel you need in there. You're going to have to request positions and screen personnel, and take interviews and hire practices, and you do job descriptions and doing all this stuff. Okay, all the stuff. And there's no point going into detail there, because you're going to have to basically be that. Okay, you're going to have to provide formal appraisal, all the stuff that the department heads do. You're going to have to promote open lines of communication within your organization. You're going to have to collaborate with other team members, okay, other department heads. You're going to have to make recommendations for improvement of operational procedures, okay, to promote open lines of communication. This is all based upon the knowledge base that you have. And you're going to have to run a budget. Okay, we're not going to talk about that one at all, but just want you to know you're going to have to monitor budget and monitor the compliance related to it. There's going to be other duties that could be assigned to you. Special projects could be assigned to you. Okay, and when requested, you might participate in short and long-term planning sessions with top management. What does that mean? Let's say that you're in a large hospital and management decides that they want to add on a wing to the present facility, or they want to create a separate building, whatever. You're going to be involved in that, and the reason is because there's security and privacy issues related to the building of that, and they're going to need your input about, all right, what technology do we have to do this? What's your rules now about locks and chains and all those kinds of things like that. And when it comes to compliance with HIPAA, OCR expects you to do what's called reasonable and appropriate. Let me introduce that to you, okay? What that means is what you do is got to be based upon basically your size and your resource, okay? Now, the initial security risk analysis, that's a defined process. It's the same for everybody. It doesn't matter what their size is. The process is the same, but the scope can be different. So the OCR states in writing now that it'll take certain factors into consideration during an audit, okay? The size, complexity, and technical capabilities of a covered entity, the nature of the patient's population, okay? So if you're a small facility in rural West Virginia or something like that, they'll take into consideration, okay, you're small, the odds are that you're not going to have, anybody's going to be very interested in that thing. And so the odds are that you're often never land, they're not going to worry about it. Or it could be that your patient population doesn't have the celebrities that a facility in Los Angeles does, and the athletes and everything. And they're thinking, well, the odds of somebody trying to get into your thing is not a good thing. They'll take those things into consideration, okay? So they'll take them into consideration as far as the cost of remediation and security measures. So you're a small facility, you don't have as much money as a large facility does in Houston. And so what you're saying is that I know what the best technology is, but I can't afford that. But this other it will work and it will do better. So you're in effect justifying that based upon that, okay? and not only the cost, but they'll take into factor the likelihood and criticality of potential risk. So in summary, the OCR expects a facility to make a good faith effort to reach full compliance with HIPAA, but to do so in a manner that is reasonable and appropriate for their size. Now, reasonable and appropriate, always consider that in quotes, which means there's no rules for it. There's no definition for it. So how do you protect yourself? It's called documentation. You know it and I know it. You just have to document you need to have a solid report that's documenting all of the things that you thought about and all the things that you're doing and all that kind of stuff, because that's what will get you past an audit. All right, so we looked at what a HIPAA officer is expected to do and how that person is expected to do it. Let me close by looking at what type of person should be in this position. Now, I'm about to share with you just the opinion of one man from Memphis, Tennessee, but it's based upon years of experience in this thing and knowing a lot of compliance people. So let's talk about education. For a large facility, okay, I would suggest that a 4-year degree should be required. But be open to exactly what that degree is. You would think, well, they need to be a degree in healthcare administration, okay, or at least an MBA in business administration. But suppose they've got a degree in computer science or in health information management, okay. Can that help? If they're the right person, it might be okay. It's just something to think about, okay. But I would suggest that for a large facility, a 4-year degree probably should be it. Okay, you might even consider a plus if somebody has a degree, but they've also got extensive experience. Okay, add that to the list. For a smaller facility, a 4-year degree would be a plus, but you may have to focus on just really extensive experience and certifications. Okay, remembering it's reasonable and appropriate. Okay, so let's talk about professional certifications. Professional certifications related to compliance would be a real plus if they've got a degree, but they've also got other certifications like certified in healthcare compliance, certified in healthcare privacy compliance. That would be good. Okay, certified compliance and ethics professional, registered health information administrator. Okay, what a certification is extra time spent in deep study on a particular subject, okay? And so if they've got a degree and then they've got some certification, good thing. That's a good thing, okay? There's professional certifications related to IT. That would be a plus, okay? Because they're going to be, whoever's in this position is going to be working with IT people. So there's a certified information system security professional, certified information system auditor, okay, kind of thing. Or they could have a PMP, a project management professional. That's good. And why would that be good? Because HIPAA is a continuing project. It never ends. Okay, and so if you really know how to manage a project and you've got some good training in, that's a very good thing. That's a plus for them. Let's look at experience. Okay. Everything I'm going to talk about right now, it's not required. I'm just going to throw out ideas for you. So that's all I'm trying to do is help you with ideas. Okay. If somebody has specific experience in working effectively with a consensus-driven organization in healthcare like a hospital, that is good. Okay, and it should be required, in my opinion, for a large facility. Okay. If they got significant knowledge of or experience in dealing with healthcare regulations, especially security and privacy, that would be good. Okay, that would be good experience to have because they're going to have to deal with that. Significant knowledge or experience in dealing with regulatory agencies and their personnel, that'd be a plus. Now, they've been through an audit, so they know something about it. Good idea. They have experience working in an IT department in a large hospital or clinic. That would be a plus. Why? Because they're going to have to work with IT people. They've experienced working with IT IT personnel while in a leadership position in a hospital, in a large clinic. That would be a plus. Think about that. You've had some kind of a main position in a hospital, but you've also worked very closely with the IT personnel. That's great. That's a good thing. Additional requirements. Okay. There needs to be a high level of integrity and trust. This position requires that. Let me just digress and tell you why. Okay. You're basically going to be given the role of changing the culture of your organization. And what people need to be able to trust you. If you go and sit down with a group or somebody individually, and you're saying, okay, here's what's happening, okay? We have to make some changes here, and you're going to have to be involved in this. There can be some changes in what you do. You're going to have you're going to get good training on the thing. It may be a little tough on you and everything, but it's something we have to do. What's important is that when you say that, they believe you. And they believe you because you've never lied to them. That you have a level of integrity that just glows. And they know that. They know that this person would not come to me and tell me this if it wasn't true. Okay? That's an important thing for success in your job. You need to have demonstrated skills in collaboration, teamwork, and consensus building. That'd be a good thing. Why is that? Because there's going to be lots of collaboration, teamwork, and consensus building going on in your world. You need to have demonstrated skills in solving problems to achieve goals. You need to have demonstrated verbal and written communication skills. Okay, that would be good. Why? Because there's going to be lots of written and verbal communication. Demonstrated skills in teaching and coaching and presentation. That would be great, but if that's not something that you got, okay, then you just need help in doing that. We talked about that earlier, okay? That you've demonstrated successful project management expertise. That would be great because you're in a constant project management process, all about it. So let me now close by giving you some possible candidates, okay? Let's take candidate number one. This is a person who has successfully managed a department or function in the hospital, plus they've got significant exposure to IT related to HIPAA regulations. That would be good, okay? That would be a good thing, okay, for them. Now, why is that? Because they were already familiar with the clinical setting, okay, and some regulations, probably already been involved in managing a project. I mean, they've got hospital experience plus exposure to IT, they probably have. They need to focus on learning HIPAA regulations. Well, guess what? Everybody does. Okay. And they may need to focus on learning more IT technology related to HIPAAs. So what? Everybody else does. Candidate number two. This is a person who has successfully managed the IT functions of a hospital or clinic. Now, I've had some pushback on this, and they're saying, well, just because you got an IT background, you're saying that. Well, no, I've actually seen this, okay? This is somebody who's already familiar with, but this is a small place. Understand, this is only a small place. This is somebody who's already familiar with IT technology, the clinical setting, regulations, developing detailed plans for implementing systems. They're familiar with that. Probably already been involved in managing projects, okay? They need to focus on learning HIPAA regulations just like everybody else did, okay? But that might be an option that you're faced with, okay? Candidate number three, a person who has experience in project management, but is also familiar with IT technology and some regulations. Once again, small facility. They would need to learn how a hospital and clinic functions, okay? But if they're really bright and they've gone through some other training, this might work, okay? They need to focus on learning HIPAA regulations. Everybody else does, okay? They need to focus on learning more about IT technologies that are related to HIPAA. Understand that, okay? So, achieving full compliance with HIPAA, which is changing all the time, it's not an easy undertaking. It's going to require the input and cooperation of every department in the facility. But more importantly, it's going to require the right person in charge of this project. So, who is in charge in your organization? Or even more, is the person currently in charge of taking your organization on willful neglect and moving it toward full compliance with HIPAA? Is that the person that should be in charge? I mean, I'm not trying to hurt anybody's feelings. I just throw that out as a question to ask. If you have got this position, are you ready to do all of this stuff? Okay, it's just something that you need to take into consideration. That is my presentation. I turn it over to our host.
Thank you, Jones. It was a really knowledgeable presentation. So, as we are in the end of the session, let us move to the Q&A. I'm going to unmute the lines of the attendees So if there are any questions, they will ask you right now.
Well, there's a question. Is there any way to print off the slideshow? Okay, well, that's in your hands. Okay,
All right.
that's not
And
me.
the lines are on mute. So is there any questions with anyone? I have sent you a question, Mr. Jones,
Um, where's the question?
in the chat.
Well, I see the question before.
No, it is in the chat. If you remember, I sent you a hi sometime back.
Okay. All right. How current is the risk analysis documentation as required by the security rule? How current is the risk analysis documentation? Well, what I've showed you is there's a starting point. Okay, that's you have to get through that first, and then after you've gotten started and you've got proof that you've done your initial security risk analysis, then you've got to do something every 90 days, even if it's just document that I had some meetings. Okay, so you're going to have to show the things that you've done, and if you have a system that by putting that in there, it will actually calculate what the risk analysis is. Okay, then you've got a tool that will work. Okay.
Okay. Any more questions with anyone? I've just got one single question. Okay, so I think there are no more questions. You can also send your questions to us via email to our email address, which is support@hipaaejona.us, and a recorded version of this webinar will be available on our website with the slide deck. We'd love to hear from you with your valuable feedbacks and testimonials. Please browse our websites for our upcoming webinars. And our website URL is www.hipaaejona.us. And thank you everyone for participating, and thank you, Mr. Jones, for a knowledgeable presentation today, and have a great day ahead. Thank you, Jones. Thank you, everyone.
You're welcome.